Hey guys, it's Dr. Green here from Lake Norman Health and Wellness. We're talking about when we should take our thyroid medications. Now, this is something that I chat with a lot about my patients because a lot of people are taking their thyroid medication at a time that maybe is difficult for them, and they've been told you have to get so much time before you can eat anything else or take anything else. And a lot of people ask me because it's very difficult when you take Synthroid, levothyroxine, or even Armour first thing in the morning. And again, you gotta wait, 45 minutes, 90 minutes? I had a patient the other day who said her doctor said don't eat anything for 4 hours after taking her medication. Well, even other prescriptions, even supplements, what about breakfast, right? It's very, very difficult. So I decided to do a good bit of research to identify the underlying reason why medical doctors, particularly endocrinologists in this country, recommend taking the medications in the morning. The main reason appears to be avoid trouble falling asleep. As for some people, thyroid medication can cause trouble with sleep. It can keep you awake. It's likely because the relationship between the adrenal hormone cortisol and the hypothalamus pituitary axis, which regulates all hormones in the body, including TSH. Mechanically, levothyroxine and Synthroid works no differently in the presence of food as in its absence. It's doing the same thing. What changes is how much of the drug is absorbed, with some published studies showing about a 20% drop if Synthroid is taken with food compared to an empty stomach. Of interest is that 2 important studies published in medical journals have found that taking the same dose of thyroid medication at bedtime may actually be better than taking it first thing in the morning. A 2007 study published in the journal Clinical Nutritionist and a follow-up larger randomized trial reported in the December 2010 issue of the Archives of Internal Medicine both showed this response. The studies were prompted by observations that some patients had improved thyroid hormone profiles after they switched from taking their levothyroxine in the morning to bedtime. Not only did they evaluate the impact of thyroid hormone levels by changing the time of medication, they also evaluated the impact this had on TSH and thyroid hormones and thyroid hormone metabolism. The studies were fairly conclusive in their findings, which the researchers said were striking and which have important consequences for the millions of patients who take levothyroxine daily. Researchers reported that taking medication at bedtime, rather than in the morning, resulted in higher thyroid hormone concentrations and lower TSH concentrations. TSH decreased and free T4 levels rose in all patients by changing T4 ingestion from early morning to bedtime, and T3 levels rose in all but one subject. TSH decreased irrespective of the starting TSH levels, suggesting better absorption of the thyroid medication when taken in the evening. Your pituitary gland makes TSH in response to you needing thyroid hormone. If you're absorbing more, you don't need as much, so TSH is going to go down. Interestingly, the researchers found that the circadian TSH rhythm, which is the typical daily fluctuations of TSH that occur during a 24-hour period, actually did not vary. And they also suggested several explanations for the improved results. Even when waiting at least 30 minutes to eat, breakfast may be interfering with the intestinal absorption of levothyroxine. Bowel motility is slower at night, which means that it takes longer for the levothyroxine tablet to transit through the intestinal tract, resulting in longer exposure to the intestinal wall and therefore better uptake of the medication. The conversion process of T4 to T3 may be more effective in the evening. The researchers found that the patients taking nighttime levothyroxine had a drop in TSH of 1.25. That's a significant change. The free T4 level went up by 0.07. And total T3 went up by 6.5. According to the researchers, there were no significant changes in the other factors. The researchers in both studies concluded that given the improvement in thyroid hormone levels, physicians should consider prescribing levothyroxine to be taken at bedtime. This research published, I feel the following major implications exist for many of our patients. First, it's easier as you don't have to worry about when to eat breakfast. Second, it's easier to take your supplements, foods, and medication, including calcium and iron, that can interfere with thyroid hormone absorption. For those with blood sugar problems, especially my patients with reactive hypoglycemia or low blood sugar, it would make it tremendously easier in the morning to get your day started. Fourth, it might offer some improvement in symptoms to people who are just not getting optimal absorption by taking thyroid medication during the day. While these only represent a few studies, they confirm what many patients have been reporting for years, that they feel better if they take their thyroid medication in the evening rather than the morning. I do not advocate you switch on your own, but would absolutely recommend you tell your healthcare practitioner who prescribed your thyroid hormone that you want to try changing the time you take your prescription to bedtime versus morning. If you decide to change to taking your thyroid medication in the evening, Make sure we check your thyroid levels via blood tests in 6 to 8 weeks to help us determine if you need to adjust the dosage or timing of your medication. I do need to caution those of you on Armour, Thyroid, or other T3-based thyroid hormone replacement medications. This research was not done on T3, but only T4. So we simply don't know if the results will be the same. I can tell you, I'm not opposed to you trying the same thing we're advocating, but keep in mind sleep quality could be impacted in some patients. I will tell you personally, I have seen good results with a large number of my patients who are on Armour or Thyroid or Westroid or compounded T4, T3 bioidenticals and switching to nighttime, but I have seen a few people who have trouble sleep. So you got to be careful when you try it. To learn more, visit my website at www.drakibagreen.com, drakibagreen.com, or call my office, 704-987-3993, and schedule a consultation with me, Dr. Green, today.